Hi everyone, I'm Dr. Sophie. Welcome to Plastic Surgery Boutique. So you reach us for scar revision. So let me explain to you a little bit more about it. So if you had a scar from a surgery, we usually say that the scar is active for about a year. So it's important that during that year, you hide the scar from the sun and you prevent that there's any like stretching on it, so your scar doesn't become wide. There's different treatment that you can use on your scar to have a better scar. Some of the treatment is silicone sheet. This is called Silagen. It's really amazing. It's something that you apply on your scar, usually 2 weeks after the surgery, all the time for 3 months. You can remove it only for shower, and it helps to create a flat scar and with a beautiful color, which is pale. There's also the gel that exists that is amazing, mostly for when it's in your face or an area that cannot be hidden. So that's the recommendation when you had a surgery and you want to optimize the outcome of your scar. However, if you had a scar from another reason, like trauma or something, and you want to have the scar revised, there's different options. Depending how the scar looks, if it's the color, we can go with Morpheus 8, which is micro needling and radio frequency. If the scar appears thick, like hypertrophic scar, or widen, at that moment, I do recommend that we do a scar revision. It's a small surgery, a small procedure that we do in clinic under local anesthesia, just like at the dentist. Depending on the size of the scar, I've seen like very small scar to like the whole abdomen scars. I know that even if it's just small, it's on your body and it's bothersome. So the scar revision do an amazing job. So I do them in the clinic, depending of the scar and the location. I can use resorbable sutures, which means that you don't have to remove them, or suture that you have to come back usually 1 or 2 weeks after to have them removed. There's different technique for the closure, and that's why I always recommend that you have a plastic surgeon. I do scar revision all the time, and my technique is I would say special, and it works very well, so much that often my patient, they have the surgery and then they never come back. But what I do is a strong repair. So I repair in 3 layers, so it doesn't hold just by the epidermal. The suture inside are absorbable, and the one on top, it depends of the goal of the surgery. It's a simple surgery, a simple procedure. After the surgery, you go home, you can drive, and I ask you to have it covered for 2 days and to not wash yourself in that area for 2 days. After that, you can remove the dressing and you can take your shower. You can let the water run down, but I ask you to not rub the incision to prevent that it opens up. I usually see you a week after to make sure everything is fine. And at 2 weeks after the surgery, I will recommend you to have some silicone care to have an optimal result. You have to hide the scar from the sun for a year. And also in some area, I will recommend some compression. So I hope this answers some of your questions. If you have more, you can call the office. Otherwise, I'm looking forward to meet you. Have a good day. Bye-bye.